Hello, this is our group presentation on depression and social media. I'm Sophia Amadei, and my group members are Jorge Gonzalez, Mara Moran, and Ismarie Olmo.
Okay, so what is clinical depression? Clinical depression or major depression is a mental disorder that is characterized by persistently depressed mood, loss of interest in activities, and it causes significant impairment in daily life. A depressive episode is defined as a period of at least 2 weeks of depressed mood and certain symptoms such as irritability, restlessness, loss of interest in activities, thoughts of death or suicide, and other the general symptoms associated with depression.
So for some epidemiology, major depression is one of the most common mental disorders in the United States, as well as many of the other industrialized countries. 17.3 million US adults are affected with depression, while 1.9 million children under 17 are also affected. And nearly 90% of the persons with severe depressive symptoms report difficulty with work, home, and social related activities. And in the US, depression is more prevalent in females at 8.7% versus males at 5.3%. And persons with anxiety or depression died 7.9 years earlier than other persons. And at a population level, 3.5% of deaths were attributed to anxiety and depression. And it's a very expensive disease. It's the sixth most expensive health condition, and it's $71 billion each year is spent in the US to treat depressive disorders.
Okay, so for the prevalence of depression in social media. Teenage and adult users who spent most of their time on Instagram, Facebook, or other platforms were shown to have a considerably higher rate of reported depression than those who spent the least time in several recent studies, from 13 to 66%. There was a study done in 2017 by the San Diego State University psychologist Jean Twenge. Over 500,000 8 to 12 graders were studied. And it was found that high levels of depression symptoms between the years 2010 to 2015 increased by 33%. In that same period of time, the suicide rates for girls increased by 65%. In 2007, smartphones were first introduced. By 2015, 92% of teens and young adults owned a smartphone. Jean Twenge found that there was a correlation between depressive symptoms and smartphone adoption during that period of time, even when matched year by year. The causes and risk factors of depression. Depression is a complex issue with no definite cause. There are certain factors, however, linked to the onset of depression. There's physical, sexual, and emotional abuse, certain medications, history of traumatic brain injury, chronic medical conditions, genetic predisposition, loss of the loved one, chronic pain, and feelings of isolation and/or loneliness.
And there's certain groups at risk, and there's some disparities in the care of depression. The prevalence of adults with a major depressive episode is highest amongst individuals between 18 and 25. And among these US adults, those of two or more races have the highest past year prevalence of 11.3%, which we see is higher than the average. And depression is more prevalent in females than males, so that's already predisposes you. And people with substance use and anxiety disorders, people with an immediate family member with depression, people with chronic health conditions like diabetes, and the lifetime prevalence of a major depressive disorder amongst Caucasians was 17.9%, as opposed to African Americans, whose prevalence estimate was only about 10.4%. But the chronicity of this disease, aka having it last throughout your whole life and with lack of treatment, was at 56% for African Americans compared to 38.6% for Caucasians. And this is due to like a systematic barriers in healthcare for those of minorities and a lack of acceptance in other cultures for depression and other mental disorders.
So how does social media tie into mental health exactly? Since it's a rather new field, we really don't know much about it, but there has been some rather novel research studies that show that certain phenomena such as interaction with an individual's post. So say you post something, people like it or they don't. It's said to be a powerful mood influencer, and people can begin to tie their self-worth into how much interaction their posts get. Comparative behaviors are common, especially among teens and young adults, and also among more common among females than males. And social media and other forms of technology, specifically screen technology, has a poor effect on sleep as blue light and stimulation can block melatonin release, boost stress hormones, disrupt circadian rhythms, and really create a barrier to getting adequate sleep that is vital in both physical and mental well-being. Feelings of isolation may also rise from interaction with social media, as feelings of comparison and idealization of the lives of your peers may lead to FOMO, or fear of missing out. And also, as social media continues to grow and communication becomes more digital, breakdown of face-to-face, interpersonal communication skills may be a problem.
Prevention. There are certain behaviors known to help prevent the onset of major depression, some of them being building positive relationships, being physically active, maintaining healthy eating and sleeping patterns, building positive stress coping mechanisms, and reaching out for help if an individual is experiencing symptoms of depression. And also with depression, there's three prevention types: primary prevention, secondary prevention, and tertiary. And for primary, monitoring and limiting your own individual social media use. Secondary is the large social media companies stop using algorithms that have many young individuals addicted to social media. And for the last one, it is encouraging people who are struggling with depression to limit their social media use. And for negative health effects, depression has effects that transcend into psychological roots, and it's been known to cause other things like chronic inflammation, chronic pain, insomnia, and other related sleeping disorders, chronic fatigue, cognitive decline, weight fluctuations, GI disturbances, depressed immune function, increased risk of cardiovascular disease. And depression is also linked to the worsening of pre-existing health conditions, and it is inextricably linked to suicide and suicidal ideation.
One treatment for depression that is commonly used is going to therapy, and there's many different kinds of therapy depending on what the client wants. And then you can also have prescription of antidepressants for the client. And exercise and avoiding drugs and alcohol are used as treatments. And there's either cognitive behavioral therapy, didactic behavioral therapy. There's all different types of therapy, as well as going to a psychiatrist and being prescribed things like MOIs or SSRIs. And here's our infographic that we base this presentation on. And it has the same information. And for our interactive activity, we're going to have a Kahoot. And here's our Works Cited. Thank you.